and welcome back to the Texas THC Doctor YouTube channel. My name is Emily, and for today's video we are sitting down on Zoom with one of our patients. He talks about his spasticity disorder and his seizure disorder and how THC has helped his life overall ever since he started using it. Thank you so much to John for interviewing with us, and I hope y'all enjoy this video.
All right, how y'all doing today?
Good, how about you?
Pretty good, Dr. Shah. Things are going well.
Well, that's great to hear. I'm sorry, I may situate myself here. There we go.
Oh, we're good. Take your time.
Okay.
Yeah.
Okay, fantastic. Yeah, I just wanted, to hear from one of my patients and see how they're doing, and really, I heard some good things about how you're doing with the medical marijuana program. Can you tell me a little bit about your diagnosis?
Yeah, I've had really bad muscle spasms my whole life. And when I was about 4, and this went untreated for quite some time, I started having miniature seizures. And as I got older, they got more intense and a little bit worse. And I went to a doctor and I tried all the medications that they had available, the prescription drugs, and the side effects were worse than what the medicine actually did for me. So I just gave up and quit until I got to a point where I couldn't. Gotcha. And that's when I went to Louisiana and met the doctor there at the healing clinic.
Okay.
And he prescribed me some tincture like you did, and it started to get everything I had medically wise, including depression. Now I'm a depression patient, and that is basically gone since I started the cannabis treatment.
That's great to hear. And how many seizures are you having now?
I've had, since I've started now, I've increased my dose just a little bit to a little over 10 milligrams 3 times a day, and they're basically non-existent as long as I stay on the medication.
That's amazing news. That's fantastic. How many were you getting before you were on?
Well, I've had as many as 13 a month.
Wow.
And yeah, so it was pretty bad there in the beginning, but as I started, they gradually came down. After about the first 10 days, again, they were non-existent.
Fantastic. And you had other diagnoses we were treating as well. I think we were also treating spasticity because you were getting a lot of muscle pains and spasms throughout your body. Is that correct?
Yes, and it's oddly strange enough, but right before I have a seizure, in the most cases, I have muscle spasms first.
So that's
almost like a sign to me that, hey, you need to do something. You need to be resting. And of course, they gave me all the barbiturates and all that. It's just horrible. It really, really is. And I hated this stuff, so I'm off of all that.
Well, it's great. I usually don't recommend people stopping on their medications. Always talk to your primary care doctor before, but you had already stopped and still having the seizures with and without them, and with all the bad side effects you were getting when you were on the traditional anti-epileptics. But yes. I'm so happy to hear, the benefits, and, hearing success stories like yours is great for other people that are hesitant to try something like this, because it carries a bad connotation with it, trying THC or CBD products.
Yes, it does. But I tell you what, once they realize the difference between the really strong medications and the severe side effects that, for example, that they provided or they gave to me, and then they try cannabis, it basically is a cure for me. I'm able to function. I'm able to go to the store. I'm able to maintain my driver's license because the doctor told me that, when I was having the severe seizures, don't drive. If you have a seizure when you're driving, you're going to kill somebody and maybe yourself.
Definitely.
So, it's a plus. And again, I'm able to maintain a normal as possible daily schedule to take care of my family. That's important.
Definitely. Improve your quality of life and those around you as well.
Absolutely, and it has.
That's amazing. Do you remember your current dose, what your ratio is?
I'm on the 1-to-1, and this time around I did try the straight THC concentrate.
Okay.
And I think the CBD actually helps the medication work a little better. That's my personal opinion between the two at this point.
Yes, I do too. So, most of the research with seizures was really with a really high CBD to a very low THC ratio. And that's why the ones they recommend initially are with those really high CBD doses. But then what we're finding out, like you, other patients of ours, that they're doing better on more equalized ratios, like the 1-to-1 ratio, or sometimes the 3-to-1 ratio. They seem to do better. And that's cool stuff that we're learning. It's really interesting that, there is more to it. Maybe you do need a more balanced ratio to have the better benefits. Plus, like you have other stuff going on, like the spasticity. So it not only has to help your spasticity, it also has to help your seizures, and that seems to be the best with a balanced ratio.
Yes, correct. And remember, I was a cancer survivor. I had stage 4 lung cancer in 2011. They gave me 16 days, and I'm walking here, brother.
That's amazing. That's amazing.
Yeah, it was too late for radiation and too late for chemo. They had to surgically remove it, and they had to take a little over a third of my left lung out to do it, but they did it.
That's
and
amazing.
I've been, basically with the cannabis, there has been no more signs of any cancer cells at all.
That's fantastic. That's fantastic. We're going to be talking about cancer and cannabis probably next week. I'm going to do a little talk, maybe a little PowerPoint presentation, just giving us the benefits of it, what we currently know, and the research that's going on as well for all different types of cancers.
That is fantastic. And anything I can do to encourage one that does suffer from any type of the ailments listed under TCO, I would suggest they try the cannabis. They have brought it down to a microdose. It does not get you high unless that's your goal, and you misuse it. But, I'm able to take my medication, my dose in the morning, and sometimes I do, and sometimes I don't take a dose late in the afternoon, but I most certainly take one before I go to bed. And it just seems to really level me out. I'm more calm, I'm more managed, I'm able to gather my thoughts and not worry about my illness, and it's just a real plus for me, Dr. Shah.
That's fantastic. That's so great to hear. It's so great to hear. Was the process hard to get qualified? What do you think?
Oh no, Dr. Shah. Your staff and yourself, I can't brag enough about you all. You made it very, very simple, and with the minimal documentation you required, I, of course, qualified immediately.
That's fantastic. Fantastic. Yeah, I love to hear success stories like yours and educate more people about it so they can hopefully partake in this and it can help them or their family members out.
Yes, sir. I agree.
Yeah, well, again, thank you for, sitting down with us and doing this meeting. I really appreciate it. Do you have any questions, Emily?
I was just going to let you know that this will be posted on our YouTube channel, if that is okay with you.
Absolutely, not a problem. Anything I can do to help others, I'm willing to do. Okay. I just hope I can help promote you and get you patients that need to be in there.
I appreciate it. Well, you have a blessed day, and it was nice talking to you. Again, any question, just give us a secure text or a call at our clinic, okay?
All right, Dr. Shah. God bless both of you, and thanks once again.
Thank you. God bless you. Bye-bye.
Bye-bye.
Thank you guys so much for watching that video. I hope y'all enjoyed it, and thank you, of course, to John for interviewing with us. If y'all have any questions or comments, leave them in the comment section below. Otherwise, check out our Instagram and Facebook for any updates about our YouTube channel. I also go live every Monday on Instagram. That's at Texas THC Doctor. Also, check out our website for any information about qualifying conditions and check it out to get qualified. That is www.texasthcdoctor.com. And yeah, thank you guys so much for watching, and I'll see y'all next week.